And with that, I'm going to turn it over to Dr. Randolph. He's going to talk about sports and perhaps some other things around our health directive, and then we'll open it up to questions. Thank you.
Thank you, Dr. Haushalter. Good afternoon, fellow citizens of Shelby County. Dr. Bruce Randolph, the health officer. Just want to spend a few moments discussing sports. As you well know, it's getting that time of the year. Many high schools preparing for their first game. Colleges, those who have decided to play, are also practicing. As I mentioned before, and you may already know, is that Governor Lee issued an executive order 55 that allowed for contact sports to occur. As stated previously, the health department's position is that we still feel that contact sports is something that we cannot recommend at this time. We feel that it's not safe. However, it is a decision that schools, non-school supported sponsors and organizations would have to make in terms of playing. Certainly it's a decision that parents would make in terms of deciding whether or not their children will participate in contact sports. Our role is primarily to provide guidance and technical assistance. Now, one thing that the health department does have a role in is determining the spectators and the fans that's in the crowd. We have guidance whereby we have limited the number of people who can be at a sporting event. It's primarily based on 12 feet separation as well as wearing of the mask. If you read the health directive, it states that for outdoor sporting events, there's a 12 feet separation requirement. Indoor sporting activities currently is 18 feet separation. We're revisiting that based on changes in our data. Of course, every 2 weeks we look at the data and reissue health directives. And so the health directive number 11 should be coming out shortly next week at the latest, pretty much corresponding to what the data has dictated to us as the changes that should occur. With that, I will stop and we will entertain any specific questions that you may have at this time.